Survivors in Iowa will continue to grow substantially. We are using data collected by the Iowa Cancer Registry and our partner organizations, including the Iowa Department of Health and Human Services, to examine the factors that may be driving our high rates of cancer. This year's report features a common cancer risk factor among Iowans: alcohol. Alcohol is one modifiable risk where Iowans stand out from the rest of the country, and that may be contributing to our high cancer rates. My main message today is meant to be a literal buzzkill. Alcohol is a known carcinogen and a risk factor for several cancers, including oral cavity, pharynx, larynx, esophagus, colon and rectum, liver, and female breast cancers. Iowa has the 4th highest incidence of alcohol-related cancers in the U.S. and the highest rate in the Midwest. Iowa also ranks 4th in the nation for binge drinking. Binge drinking is defined as drinking 5 or more drinks on one occasion for men and 4 or more drinks on one occasion for women. 22% of Iowans report binge drinking, higher than the national average of 17%. Binge drinking is also a concern among Iowa's youth. 15% of underage Iowans ages 12 to 20 report binge drinking. Any alcohol can increase one's risk of cancer, but heavy drinking and binge drinking pose the greatest risk. For those choosing to drink, it is recommended to limit intake to 2 drinks a day for men and 1 drink a day for women. Any amount of alcohol reduction is likely to reduce one's risk of cancer. I do want to make it clear, however, that there is no one cause of cancer. Rather, it is the complex interplay of different genetic, behavioral, environmental, and structural factors that alter the way cells function and produce cancer. Alcohol-related cancers can be caused by a combination of many factors that may not even include alcohol consumption in some cases. Do you all remember the game Trivial Pursuit? No, that's getting sort of an old reference, but remember the game piece, and the point was to fill in the pieces of the pie of that game piece. Now picture that that game piece represents cancer and all the different risk factors. You have to fill in all the different pieces of the pie, and when you do that, you get cancer. Some of those pieces of the pie are filled in for us by our genetics, family history, other things that we cannot modify. But think of alcohol as one of those pieces that we do not want to fill in. So it's all those things, though. And so I just wanted to clarify that it's just not the one, it's not alcohol that we can say. I don't want anybody to feel like that has one of these cancers that it was alcohol that caused the cancer. Alcohol contributed potentially to the cancer, and it interacts with lots of different risk factors. It can actually make other risk factors worse when you drink alcohol. Anyhow, this report provides resources for individuals wanting to reduce their drinking, as well as evidence-based strategies for policymakers, providers, and public health professionals that can be employed at the population level. Today we have gathered a panel that includes Dr. Michael Henry, Interim Director of the University of Iowa Holden Comprehensive Cancer Center. We also have Marissa Buchakjian, a head and neck cancer surgeon at the University of Iowa Hospitals and Clinics who cares for many patients with alcohol-related cancers, and one of her patients, John Stokes, who will discuss his experience with head and neck cancer. Thank you all for being here.
Thanks, Mary, and thank you all for coming. And I'm Michael Henry, the Interim Director of the Holden Comprehensive Cancer Center, and it's actually my great honor to be up here with these folks today. Dr. Charlton and the Iowa Cancer Registry is doing vitally important work for our state to understand cancer in this state, which you just heard about. It's also vitally important for our NCI-designated cancer center, whose mission is really to reduce the cancer burden for all Iowans through research, education, and clinical care. And the work from the registry really helps direct our efforts to where we can have the most impact. I'd also like to recognize Dr. Buchakjian, who is caring for our cancer patients every day, and amazingly also is doing research on how we can better care for cancer patients tomorrow. And then finally, Mr. Stokes, I know it takes great courage to battle this disease, and even more to get up here and share your story with everyone. So thank you very much.
I wanted the water.
Yeah, great. It's not alcohol. So maybe I will say a few words about how does alcohol contribute to cancer, just a little bit about what we know about that. When you consume alcohol, your body automatically, naturally, converts it to a substance called acetaldehyde. Acetaldehyde can damage DNA in our cells. And in addition, alcohol can also cause a type of stress on cells called oxidative stress, and that too can damage DNA and other molecules in cells. So alcohol can result in damage of the genetic material in cells. At the same time, it reduces your body's ability to repair that DNA. And so that's kind of a double whammy that can lead to accumulation of mutations. Some of the wedges in the pie that Mary mentioned, accumulation of mutations that can drive cancer. But even more than that, it can also cause inflammation and affect the function of our immune system. And that can actually cause cancers that develop to be worse and have worse consequences for folks. The good news is that this is dose dependent. And so if you reduce your alcohol consumption, you reduce your risks for sustaining these events in your cells. So now a few words about research that we're doing at the Holden Comprehensive Cancer Center that addresses this. First and most directly, we have a faculty member in the Department of Pathology, Dr. Jia Luo, whose research is focused on understanding the effects of alcohol in cancer, and he's particularly interested in how it affects breast cancer. And just reported a couple of weeks ago at a symposium that we had, a paper that he'd recently published in mice, I should stress in mice, that shows that exposure of mice at an adolescent stage, what's equivalent to the adolescent stage in a mouse, can have dramatic consequences on down the road for the risk of developing cancers and then the aggressiveness of those cancers in mice. And so it's important to really think about exposure at any time, but in that adolescent stage, binge drinking, heavy drinking can potentially have long-lasting effects. Beyond that, we have research in a number of cancer types. And one of the great things about being a part of the Holden Comprehensive Cancer Center is we work across colleges and departments. So many of these faculty members that I'm telling you about are all over the University of Iowa. Importantly, oral cancer. This is an area of interest to Dr. Bachakjian, and she's collaborating closely with the College of Dentistry to develop what's called a specialized program of research excellence in oral cancer. This is a large grant that could really help us take some big steps against oral cancer here in discovering new approaches to detecting, diagnosing and treating oral cancers. We have a considerable amount of work in colorectal cancer. We've recently recruited a new researcher, Dr. Sarah Short, from Vanderbilt University, who studies the interaction between inflammation and colon cancer. And this is one of the areas that alcohol comes to play in. We have active efforts in colon cancer screening and prevention. Dr. Barcy Levy recently reported at a seminar for the Cancer Center her work on comparing the effectiveness of different home colon cancer test kits. That was quite interesting. And finally, our community outreach and engagement team, led by Dr. Natasha Askelson, has spent the past year highlighting colorectal cancer, and we're headed into March, which is Colon Cancer Awareness Month. And this has been important to raise awareness, and again, research from Dr. Charlton has pointed out that some of the southern counties in our state are particularly prone to colon cancer development and have less than optimal screening in some areas. And one last word, some of the basic research that we do addresses this DNA repair, how cells deal with mutations. Many folks here at the Cancer Center study DNA repair. One of them is Dr. Maria Spies in the Department of Biochemistry, who has a nationally recognized research program in this area. So we're very active. Again, feel very honored to be a part of this panel and to see that the Cancer Center's work goes to address alcohol and other modifiable risk factors going forward.
Great. Thank you, Dr. Henry. Good morning. My name is Marissa Bichakjian. I'm a physician scientist and a head and neck surgeon here at the University of Iowa. My clinical practice focuses primarily on head and neck cancers, typically cancers of the mouth and the throat, also known as the oral cavity, oropharynx, and larynx. As Dr. Henry mentioned, I'm also active in laboratory and clinical and translational research with an interest in understanding how we can better treat and risk assess our patients. So here at the University of Iowa, we see over 500 patients a year with head and neck cancers. Unfortunately, as Dr. Charlton mentioned, this is a cancer that is on the rise, and we have the second highest rate of head and neck cancers in the entire country. As a state and as a healthcare system, this really means that we're seeing increased patient numbers, we're seeing a longer time to diagnosis, we're seeing patients who are presenting at later stages and having a longer wait time for treatment. So in the state currently, we're at a critical point where we're having difficulty giving timely and excellent care to patients who have oral cavity and larynx cancers. So the opportunity to highlight risk reduction for our state is really exciting for our healthcare system. The greatest risk factor for oral cavity cancer is tobacco use coupled with excess alcohol consumption. We know that patients who consume heavy amounts of alcohol have a 2.5 to 5 times greater risk of oral cavity and larynx cancers compared to non-drinkers. Since alcohol is a carcinogen, as Dr. Charlton mentioned, something that can contribute to cancer but not cause it, this makes sense for oral cavity and larynx cancer. When you consume alcohol, it touches the lining of the tissues in the mouth and then the entire covering of the throat before it gets digested in the stomach. And then if you think about binge drinking, this is prolonged and enhanced exposure of these tissues to a carcinogen over time. So over the course of someone's lifetime, this can substantially increase the risk of developing a head and neck cancer. I'd like to give you a sense of what treatment for throat cancer can look like for a patient who comes to see us. So the majority of patients might have a history of heavy alcohol consumption and smoking earlier in life, and it typically takes 20 to 30 years after these great exposures to really develop a cancer. Patients might report throat pain, difficulty in swallowing, speech, and breathing. And then if they're diagnosed at an earlier stage, they're usually candidates for chemotherapy and radiation to cure the cancer. This is great news because they don't have to have surgery. However, there are lifelong side effects to these types of treatments. And over decades, patients can have difficulty swallowing, increased buildup of plaque in their carotid arteries, and loss of thyroid function over time. For patients who are diagnosed at later stages of cancer, they are usually treated with upfront surgery. Surgery for an advanced throat cancer is a laryngectomy, which is removal of the entire voice box, removal of lymph nodes in the neck, and creation of a stoma in the neck, which is how a patient breathes for the rest of their lives. And even after this surgery, they're still indicated for radiation treatments and have to kind of have a lifelong picture of dealing with the effects from these extensive treatments. At the University of Iowa, we perform over 50 laryngectomy surgeries per year, in addition to hundreds of oral cavity cancer surgeries, on top of all of our patients who are also treated non-surgically. So we care for hundreds of patients in the state of Iowa who are presenting with head and neck cancers. As a healthcare provider, I'm concerned about the role that alcohol is playing in our cancer patients in Iowa. And it's important to get the message across today that any amount of alcohol reduction is likely to decrease the risk of alcohol-related cancers and decrease the risk of needing surgery for a head and neck cancer for our patients. Thank you.
One of the side effects she's talking about is my voice. So I will do the best I can to be heard. I've complained about that not being heard to people, and they've said, "How old are your friends?" And I don't think that'll be a problem with you guys. Okay. My name is John Stokes. I live in Iowa City, and I'm a head and neck cancer survivor. Unfortunately, I've been treated for head and neck cancer not once, but twice. 13 years ago, I was diagnosed with voice box cancer and treated successfully with radiation and chemotherapy at Mercy of Iowa City. One of the things I'll mention here is I was told at the time that if it grew back in my larynx, that I would do what we just heard about, that I'd have a hole in my neck and all that. So those type of things for a person with cancer, the possibility of cancer, is traumatic and just kind of part of going on with life. I was fortunate to do well during my treatments and to be cured of that cancer. Then in 2022, I developed a sore on my tongue that would not heal. This was diagnosed as a second head and neck cancer, and I was treated with surgery at the University of Iowa. I'm glad to say that I'm currently cancer-free and follow regularly with Dr. B for cancer screening exams to make sure I stay as healthy as possible. The Cancer in Iowa report we're discussing today shows the harsh reality of citizens like myself, with Iowans having the second highest rate of cancer in the country and the fourth highest rate of alcohol-related cancers in the U.S., which is pretty astounding. When I saw that, that was surprising. When I was younger, I had problems with alcohol. I drank frequently and would also binge drink. Never during that time did I realize that those choices could cause cancer later in life. But as we've learned today, alcohol can significantly increase the risk of cancer. I'm glad that I confronted my alcoholism as an obstacle many years ago. But I know that alcohol combined with tobacco use likely contributed to my head and neck cancers decades later. It might have made a difference had I had that information. I'd also like to mention that I was lucky, my wife played a part, but also I worked for Goodwill for a number of years, and they had both support for me being off work at that time. I did inpatient. I don't know what the current landscape is of treatment. And we had a very good insurance policy that covered that. That's a factor in getting sober, which then eliminates the alcohol as a threat. My message to other Iowans today is that it's never too late to reduce your risk of alcohol-related cancer. As a head and neck cancer survivor, I want to make sure that Iowans know that alcohol can cause cancer, and if you're thinking about making the move to drink less, reducing your cancer risk is a great motivation to do so. Thank you.
Thank you. Okay, we'll go ahead and open up the floor for questions.
Thank you.
Anyone?
Me.
Yeah, go ahead.
I guess one question I had is whether all alcohol is the same risk factor, or whether like wine is different than like vodka versus beer in terms of risk, or do you guys have any information on that?
Yeah, we kind of try to address that in the report. Just sort of think about it as units of alcohol. So there's not one that necessarily causes worse cancer than the other. It's the amount, and so it's the amount and number of drinks is sort of that dose-response relationship that Dr. Henry was talking about. We don't know of any research that has said drinking 5 units of wine is less risky than drinking 5 units of beer. As far as we know, it's the alcohol. It's what it all turns into the same chemicals once it gets into your system. So a unit is a unit, no matter what kind of alcohol it is.
Okay, yeah. And then when you talk about alcohol-related cancers, are you just talking about specific types of cancers, or is there something that you can, like how can you say something's alcohol-related?
Yeah, it's just sort of a grouping of cancers that we look at. So as we talked about, it's the head and neck cancer, so the larynx or the voice box, the oral cavity, the pharynx, breast cancer in women, the esophagus, colon, rectum, and liver. Those are known as alcohol related, so when we combine those, we can look at rates compared to other in other areas, but it's not to say that every case of one of those cancers was because of alcohol or that alcohol was even a risk factor in those. It's just known that the mechanisms of how alcohol can contribute to those cancers is known, so they're sort of grouped together as alcohol-related cancers. Sort of like the year where we did obesity-related cancers. It's not to say everybody with, colon cancer is also an obesity-related cancer, and not everybody with colon cancer has obesity. So it's just one of those things where we do know how the mechanism would happen to increase the risk for that type of cancer.
I might add, I think I neglected to say with respect to breast cancer, the mechanism is slightly different than that acetaldehyde substance that alcohol is converted into. Alcohol interferes with the metabolism of estrogens. And what happens, alcohol can elevate estrogen levels, and that can promote the proliferation of mammary epithelial cells and can promote breast cancer through that way. So that's a slightly different mechanism that that alcohol contributes to breast cancer in particular. So.
And that's an important one because one of the probably the single most cancer site driving our higher than average rates in Iowa is hormone receptor positive breast cancer.
Yeah, I was gonna kind of jump to that question because I feel like for the last year, people, since reporting that we had the second highest and highest growing, have been wondering why. And you kind of mentioned that it can't be just one thing or whatever, but do you think that this could, I mean, given that we're fourth for drinking and fourth for that we're so high that could be related potentially?
Yeah, I absolutely think it could be a contributor to that. The other cancers where we're significantly off from national trends, not to say they're the only ones we should care about, but the ones where our trends are distinctly different from other states in the U.S. Include prostate cancer. And heavy drinking is associated with prostate cancer incidence and mortality. Prostate cancer is just a lot more of a mystery to us than a lot of other cancers, but research suggests that alcohol plays a role in that one as well. And breast and prostate cancer, we have among the top 10 highest increasing rates in the country for those two types of cancer. But the other two that are contributing to our rates being off are lung cancer, and we know what causes that. 80% of lung cancers are caused by tobacco, and then the number one cause of lung cancer among non-smokers is radon, which we've talked a lot about in past years. And then the fourth one, where our rate is climbing much faster, we're ranked fifth in the country, and we have one of the fastest rising rates in the country, is melanoma. And the primary driver of melanoma, obviously ultraviolet light from the sun or use of indoor tanning beds. So unfortunately, our cancer problem in Iowa, there's not a smoking gun here that I can say is contributing to all the places where we're off. But alcohol is certainly, almost certainly, contributing to two of the cancers that are really driving up our rates.
Other questions from the crowd?
I have another question.
Go ahead.
Is it still?
Yes.
Okay, sorry. I just was wondering how many years it was between when you were sober and then we were diagnosed with cancer.
I got sober in 81. So, what is that, about 38
Yeah.
or something like that. A long time, decades.
Yeah,
Yeah.
like 3 years almost.
Yeah.
Yeah, okay.
And that's typically what we see, honestly, even for smoking-related cancers. It's a matter of decades, even after stopping that exposure, that the cells kind of continue to change and build up mutations. And, it takes decades to cause a cancer after that heavy exposure.
I smoked till I was 50, so that wasn't as long.
Oh, okay, because, right, so how old were you when you were sober?
36.
36, okay. But then you smoked until you were 50.
Yep. It was a lot harder to give up, to be honest. I was amazed at that.
And can I ask how old you are today?
77.
Okay. sorry, Mary, you said that there were two cancers and so prostate was one. What was the other one that were off on the alcohol?
Breast cancer.
Breast, right.
And we do see with our breast cancer rates that it's largely hormone receptor positive breast cancers that we're out of line with the rest of the country. So that's, kind of another reason we wanted to focus on alcohol. And people keep asking, why Iowa? Why would Iowa be number 2? This doesn't make a lot of sense. And so we really started to focus on the risk factors where we are high. And the first one that comes up is binge drinking. But there are others. We have a high rate of physical inactivity. We don't have the healthiest diet. Again, we talked about radon. We still have at least 15% of our population who smoke. We just have this mountain of pebbles. And if we look geographically at the 4 types of cancer that I said where we're really off, lung, melanoma, breast, prostate, we see lung cancer being really concentrated, or I shouldn't say concentrated, but highest rates in the southern tiers of those counties of our state. When we look at melanoma, we see that, the high rates, in the northern tiers of our state. When we look at prostate cancer, we see that in the western tiers of counties in our states. And when we look at breast cancer, we see that like the highest rates are in the cities. That's likely because people who live in the cities tend to have higher levels of education. Women who have higher levels of education tend to put off having children till later in life, and that is a major risk factor for breast cancer. But all that to say, it can't be just one. It can't be one thing, that's causing these very different types of cancer to occur in very different parts of the state. But one thing that that is common among 2 of them and common across Iowa, if you look at that map of binge drinking, is alcohol. That is something that we, as a state, tend to collectively do quite a bit. So that's where we wanted to focus this year's report and start with that one.
Mary, do we know, so with oral cancer, both alcohol and tobacco use can contribute. Do we know whether they are simply additive or whether they interact in some way
I
that
believe there's an
enhance
interactive multiplicative
effect
of them. Yeah, so there's a risk, obviously, of drinking alone, a risk of smoking alone, but you put them together and the risk is more than double. It's more than adding them together. So I think they work, unfortunately, synergistically to damage cells and inhibit repair.
Yeah, go ahead.
Do you know if HPV has a similar interactive?
It does. I think both smoking and drinking interact with HPV. It makes it, I'm not an immunologist here, but both of those things make it harder for the immune system to clear HPV. Most of us in this room, most of us in the state, most of us in the country, the overwhelming majority of people have had HPV. 90% of people can clear it, and it never becomes a problem. We see, and I think Marissa can probably speak to this, the people that she probably treats that have HPV-related cancer, so they're testing it and they see that HPV was sort of the culprit. A lot of those people probably also smoked and drank because it made it harder for their systems to clear that HPV. And people of ages like John are, too old to have gotten the vaccine. The vaccine is too new for a lot of the patients coming through now. But that's another reason that's so important to get the HPV vaccine. That's a major risk factor for head and neck cancer. And by not getting HPV, then there's nothing for alcohol and cigarette smoking to interact with. They still could cause a different kind of head and neck cancer, but that's a terrible combination to have HPV and smoke and drink, or any 2 of those 3.
Yeah. Historically, if you have one patient who has an HPV-related oropharynx cancer but never drank, never smoked, compared to someone with a similar cancer who has those exposures, that person does much worse. They don't respond as well to treatment. Their disease is typically more invasive, and their prognosis is less, even just kind of on a stage-to-stage basis. So I agree. I think that they're synergistic.
So what can we do about this? If we want to reduce Iowans' risk of alcohol, what are the strategies to do that?
Yeah, well, I think, obviously, as individuals, we can choose to drink less, and that's what we're here to build awareness to do. But sort of leaving it to individuals to make that choice on their own has still gotten us to the number 2 highest cancer rate in the country. I think it's definitely time to look at a population level. what are the things that we can do at a population level, whether it's policy, legislation, programming, things like that, that make it easier to make the healthy choices and harder to make the less healthy choices. And so in the report on page 13, on page 12, we talk a lot about policies like an experiment kind of in Scotland, minimum unit pricing, in which a floor price is set below which a unit of alcohol cannot be sold. That's something happening, never has happened in the U.S. Don't know if it's possible, but there's levers like that. There's maintaining and strengthening laws that hold alcohol retailers liable for injuries and damages caused by their intoxicated customers. I know that the restaurant business would like to do away with a lot of those things, but they're really important. They're really important to maintain and maybe even strengthen. For providers, screening and brief intervention to reduce excessive alcohol consumption is really important. Your provider has very limited time to talk with you. Most of us probably can't remember the last time they ask you how much you drink, but they don't often spend a lot of time doing something with the answer of how much you drink. And so, giving them more tools and time to do alcohol counseling with patients would be really important. There's lots of other policies mentioned in here that could be considered that would make it easier for Iowans to make the healthy choices, because left on our own, it's really hard.
It's interesting that your data shows that the rates of binge drinking are actually higher in folks with higher socioeconomic status.
Yeah.
And, so
Yeah.
there might be an economic solution,
that's right.
To this that would be tenable.
If you think about it, I found it very shocking, the chart on page 10. It showed that people, if you think of like who binge drinks, if you just didn't know better and you just thought, you'd think, well, it's probably those, college age kids, maybe people who have lower education, maybe lower income people that don't know better. You might make that assumption. But if you look at that chart, you can see where Iowans really excel compared to the rest of the country are more educated, higher income, older populations, where you see the biggest difference between that blue bar of Iowa and the green bar of the United States. It's every category of every socio-demographic characteristic where Iowans are higher than the rest of the country at binge drinking. So I think that it's going to take a lot of policy and initiatives and education and building awareness across all of those groups. And again, that financial things that have a financial stake may help, but it's something worth considering. And if you look at the map of binge drinking, there's not a clear pattern. You see blue, dark blue, most of the map. I mean, it's pervasive throughout our state. And I think it's a cultural thing in our state, and it's something that I think people just need to be aware of. As we mentioned in the report, only 40% of the general public even knew that alcohol could contribute or cause cancer. So we hope to really build awareness around that.
Where was that awareness? Is there a graph in here you said that talks about the awareness?
I think we just mentioned on page 7.
Oh, okay.
Second paragraph, all types of alcoholic beverages and any amount of drinking increases one's risk of cancer, yet only 40% of adults know that alcohol may increase cancer risk.
It's the celebration song. That's the problem. The beer song. I was just wondering, John, really fast, where did you grow up?
Davenport.
Davenport.
Yep.
Okay. But you live in Iowa City now?
I do. I moved around. I was of that hippie age.
Did you go to the University of Iowa?
Several times.
Great. Anyone else? Okay. Terrific. Thanks again for coming. If any members of the media would like to do individual interviews with any of our panelists, come on up and we can make that happen for you. But otherwise, I think we'll wrap things up and appreciate you coming today. Thanks very much.
Thank you, John.
Yeah, you're wonderful.
Thank you, Marissa. You guys were
I knew he would bring some comedic
Yes.
Yes, indeed. Several times.